Coming up next on Being Well, vascular surgeon Dr. Brian Wheatley from Carl will be here to tell us more about the vascular system and the problems related to it, such as plaque buildup in our arteries, stroke, heart disease, and more. It's going to be an informative program this week, so don't go away. Well, Dr. Wheatley, thank you for coming on Being Well. This is your first trip here. We're happy to have you here.
Pleasure to be here.
So you're a vascular surgeon, and I'll admit when I found out you were coming on the show, I didn't really know what that was, and I'm guessing a lot of our audience may not either. Why don't you tell us a little bit about your area of specialty?
Well, vascular surgeons, they're specialists that deal with vascular disease, so diseases of the arteries and the veins. We're a bit unique in that we treat all aspects of vascular disease. We're the only specialty that does the medical management, so we work with primary care physicians, cardiologists, in terms of risk factor modification and making sure the person's on the right medications. We will order and interpret vascular tests, so ultrasounds, CAT scans. We offer all aspects of treatment, so non-invasive or minimally invasive catheter-based procedures like angioplasty or stent procedures, or the traditional surgery. So we do it all. We work very closely. It's a team effort. You know, we work very closely with primary care physicians, cardiologists, neurologists, but as a team we come together and we work out what's best for the patient.
Okay, so explain what the vascular system is in very layman's terms. It's arteries and veins. What's
arteries
the
and
difference?
veins, it's you know, some people call it the circulatory system. The arteries are the big muscular arteries that come from the heart, and they go off to the tissues, to the brain. They actually feed the heart. They go through the abdomen, the chest. They feed the GI tract, the kidneys, the lower extremities. And the veins are on the other end, so they bring all the blood back to the heart. So the arteries carry the oxygen, the nutrients out to the tissues. The veins bring all that blood back.
So the veins are typically the things that you see, you know, on your hands. Mine seem to stick out a lot.
Right.
Is it common? Is there anything wrong if you see your veins popping out in your hands and your feet?
Usually not.
Okay.
Usually I tell my patients, if you can see the veins you see in your hand and in the top of your foot, maybe just around your ankle, those are normally protuberant, and those are normal.
Okay.
Veins that bulge out anywhere else are almost always abnormal. And vein disease, it's probably one of the most underdiagnosed problems because people have been living with it for years. They think it's no big deal, and most of the time it isn't. But if you're having problems and you think that it's due to your veins, it's always worth getting them checked out.
Okay, so let's talk about the kind of diseases you see as a vascular surgeon. What are the most common things that you're treating people for?
So, you know, again, if we break them down into arteries and veins, the arteries, on the artery side, I tell people, you know, it's a problem with either too much blood flow or not enough blood flow. Too much blood flow, we'll talk about things like aneurysms, so bulges in the arteries, and these can happen almost anywhere in the body. Not enough blood flow is often due to obstructions or blockages, and again, depending on what type, where in the body they're located, you'll have different problems. Blockages in the heart arteries will cause heart attack. Blockages in the neck arteries will cause stroke, or can put a person at increased risk for stroke. Blockages elsewhere can cause pain in the legs when you walk. They can cause sores not to heal, and they can lead to amputation. On the vein side, we will often see problems with varicose veins or bulging veins, and this usually is secondary to weakened vein tissue. So, you know, two different things, but you know, we'll see a variety of people with often more than one thing going on.
So if someone is seeing their primary care physician, how do they know? How do they know that, my gosh, I need to see a specialist like you? Who ends up getting recommended for a vascular visit to someone like you?
It's often people at risk for vascular disease, and the people at greatest risk are going to be the people that have a family history of heart attack and stroke, people who have smoked or are current smokers, people with a history of high blood pressure, cholesterol, and then patients with symptoms. So the people that have not had problems will often have a vascular test done. And sometimes the primary care physician will just send the patient with this test to the vascular surgeon to have it interpreted and to go over what needs to be done. Patients that are having certain symptoms will be sent to me as well, and at that point we'll order a test and we'll talk about where to go next.
So we often we like to talk about prevention on being well.
Right.
What are some things that we can do right now to make our veins and arteries more healthy so that we're not at risk for stroke and cholesterol in our veins and all those bad things that happen to us?
So we break down risk factors into things we can do something about and what we can't do something about. Getting older, we can't change that. That is a risk factor. Men are more likely to have problems with plaque buildup than women. Those things we can't really change. What we can change, by far the biggest, is smoking.
Okay.
So smoking is, as most people know, there's hundreds of toxic chemicals in smoke. The big things are nicotine and carbon monoxide. These have horrible effects on blood vessels. Even after 2 days of not smoking, you'll see a person's heart rate go down. You'll see the blood pressure go down. The blood flow to their hands and their feet will improve. This is after 2 days of smoking cessation. So we work very closely with primary care physicians to come up with strategies to help people stop smoking. It's critically important. The other big risk factor is cholesterol. And with cholesterol comes diet and exercise and those type of things. So again, those are very important. But we'll work with making sure the person's on the right cholesterol medication, make sure the cholesterol's checked and that it's in the right range. And then blood pressure is probably the third biggest risk factor. Other ones, diabetes management, other triglycerides, things like that. There's a long list of things that will make sure a person's had done, even if they're not having symptoms, just to make sure they're on the right path.
So let's talk a little bit about high blood pressure. It's referred to as the silent killer. Why does that create such a problem for our blood vessels?
Well, it causes a problem because it's prevalent. About 75% of people are going to have high blood pressure at some point in their life. The exact effect on blood vessels is you can think of a normal healthy blood vessel as a smooth tube, muscular tube. And as we age, the tube tends to stiffen and harden, and that's what's called atherosclerosis. Inside the tube, there's a very smooth lining, and this lining over time can become irregular. This is where plaque forms, and the pressure inside the tube has a direct effect on this plaque buildup and the fatty and cholesterol deposits that form on there. And so blood pressure is critically important, not just for blood vessel health, but for heart health and stroke risk.
Are you seeing younger and younger people with high blood pressure now because of obesity?
Yes, obesity does play a role with blood pressure overall. We see more people with hypertension, which is high blood pressure, because we've lowered the standards. At one point we thought that this number was okay. Now it's down to 120/80. That's the recommended, being below that, and that's what your doctor will work towards. Not everybody's going to be right there, but that's the number, and we've continuously lowered the bar because we found that people with higher blood pressure are going to be at increased risk for stroke and heart death.
Okay, let's talk about another serious issue, and that's stroke. There's an acronym out for signs of a stroke face. Can you explain?
Right. So this is a big public service issue. Most people are aware of heart risk and heart attack signs, the chest pain, the left arm pain, the jaw pain. We were trying to make people aware of stroke symptoms because, again, time is brain. That's what we tell people. The more time that you waste or that you wait after stroke symptoms, the more brain tissue gets damaged, and some of it's irreversible damage. So we talk about the symptoms in terms of speech problems, either trouble speaking or comprehending, facial asymmetry. So patients, you look at your family member and their face doesn't line up, or their smile is not symmetric, or they have a droopy eye. Weakness or numbness on one side of the body. And this is something that, again, you don't call your doctor in the morning, you call 911 and you get to the hospital immediately because time is brain. Okay.
And are there, because I've heard that there's medications, if you catch it early enough, you can give someone a medication for stroke.
Right. So when you go to the emergency department, they'll do some very rapid assessments. We have a stroke team at Carl that responds once the person hits the hospital. And they work with neurologists and neurosurgeons and the emergency physicians to decide, is this person a candidate for very powerful, very intensive medications that could arrest a stroke. Not everybody's a candidate for this, but only if you go see, if you're in the hospital setting, can they decide if this is the right thing for you. And then at the same time, no matter what happens, we try to figure out what caused the stroke. And this is where I come in, and one of the biggest causes of stroke is ischemic strokes, so blood flow strokes.
Okay. So that's lack of blood flow.
Lack of blood flow. Okay. So there's a blockage somewhere.
Okay.
And the neck arteries, the carotid arteries in the neck, are the most common source of that. And there's a very simple, very straightforward test we can get to see if there's a blockage there that we can do something about.
Okay. We hear a lot on TV today, a lot of advertisements, and now we're seeing a lot for peripheral artery disease, or PAD. Right. Why are we hearing so much about that now?
So PAD, or peripheral arterial disease, sometimes it's called peripheral vascular disease. The words are interchangeable. It's very prevalent, and it's severely underdiagnosed. It's thought that as many as 12 million people in the United States have symptomatic PAD. 27 million in US and Europe have PAD. Most of that, probably 3/4, is not detected. So why it's important, obviously people can have problems with it. You can be symptomatic. You can have pain in your muscles when you walk, calf pain called claudication, very common symptom of PAD. More advanced disease could be pain in your feet at rest, or sores that don't heal. And these issues can lead to amputation if they're not dealt with. But probably the biggest thing that we talk to people about is that when you have PAD, you're at 3 times more risk for heart attack or stroke.
Okay.
And that's what kills people. Heart attack is number 1 cause of death. Stroke is number 3. Cancer is number 2. So PAD is associated with the number 1 and number 3 risks of death in the United States. There's very easy tests to detect PAD. Just a simple Doppler test that your physician can order. And it can give us a ton of information about, again, getting people plugged into the system, making sure that their risk factors are controlled. Oftentimes, nothing needs to be done. There's no specific therapy other than help the patient stop smoking, make sure their blood pressure is controlled, make sure their cholesterol is controlled, make sure they have an exercise regimen and know what foods to eat and what foods to avoid. And so it's critically important that we capture these people in our medical practice and get them on the right path to PAD health.
So real quick, PAD, is it a blood clot in the
It can
vein?
be. Yeah,
so vein or artery?
Artery.
Okay.
Right. So all these aneurysms, blockages, atherosclerosis, this is on the artery side of things.
Okay.
So again, going back when we said that a normal blood vessel is a smooth tube. You get this plaque buildup on the inside. This plaque is usually cholesterol and fat that builds up over years. When this narrowing becomes critical to the point where blood flow can't get through the tube anymore, you start to have problems. PAD often happens in the legs. It can happen in the GI tract. It can happen in the arms. It can happen in the kidneys. In the legs, we see people with this plaque buildup, and they can't walk. They have pain when they walk, and that's just because the muscles can't get the blood flow they need. When it becomes real critical, the blood flow can't support the skin, and you have sores or gangrene.
Okay.
So yeah, plaque buildup can happen anywhere in the body, and it just depends where it happens, and that's the type of symptoms we see.
Okay, so let's talk about another issue, and that's aneurysm. Usually when you hear someone has an aneurysm in the brain, it's usually fatal. But first of all, explain what is an aneurysm, and can it happen anywhere in the body?
Right.
Is it just limited to the brain?
No, it can happen anywhere in the body.
Okay.
In fact, the most common place is in the abdomen, and that's where I see a lot of people on a weekly basis with this. An aneurysm is a bulge. So again, the arteries are a pretty thick muscled wall. And over time, for a variety of reasons, a lot of the same risk factors that cause blockages, the smoking, the high blood pressure, the cholesterol, can cause a weakening of the artery. And this is for other factors involved as well, but the artery bulges out. It becomes like a balloon.
Okay.
And this weakened wall over time, it'll continue to enlarge to the point where it becomes so weak that it ruptures. Now, aneurysm rupture, people will hear it called AAA or abdominal aortic aneurysm. This is an aneurysm inside the abdomen, just below the kidneys. This is not an uncommon cause of death. I think it's number 12 or 13 on the list, so 15,000 people a year. The interesting thing about this is that number hasn't changed. And we think of all the all the medical issues that we've dealt with. We've helped improve cancer survival rates and so forth. Aneurysm mortality has not changed because when it ruptures, it's bad news. And 95% of people will not survive. So the goal with aneurysms is to find them and to, again, get people plugged into the system with ongoing surveillance. Oftentimes, we don't have to do anything about it. We don't have to operate or put a stent in. We can just watch it.
Okay.
But aneurysms are a very significant source of problems in the United States, and detecting them is our main concern.
That's what I was going to say. How would you even know you have one?
Right. So symptoms of aneurysms are very rare. If you have symptoms and you have a known aneurysm, that's an emergency. You have to go to the emergency room. People, upon entrance to Medicare, if you have a family history of aneurysms or if you smoked, you will get an ultrasound screen.
Okay.
So at age 65, within a year of being enrolled in the Medicare program, you'll get a screen. Patients who have at a high risk for vascular disease, so if you've had a history of a heart attack or a stroke, or if you have known PAD, those people are at increased risk for aneurysms and can get an ultrasound. The ultrasound is probably the easiest test. It doesn't work for everyone, but for most people, we can at least see the artery in that area and decide if there's an aneurysm there. And again, 70 to 80% of the time, we see a small aneurysm, and there's nothing that has to be done other than make sure the person has good follow-up.
Okay, so let's talk about maybe some of the more, spider veins, varicose veins. It's a cosmetic issue, but it can also be a health issue if you have varicose veins. At what point does it go from being cosmetic to medically necessary to do something about varicose veins?
Yeah, varicose veins are common. A lot of people have them. They're often written off because people think, well, they've been there for years. They're probably not causing any problems. But the truth is they can cause problems.
Okay.
Venous disease is a spectrum. So at the very mild end, one varicose vein, it doesn't put you at increased risk of heart attack or stroke, but it can cause symptoms. Leg heaviness, leg tiredness, fatigue, pain, achiness. People describe it in a variety of ways. There again is a very easy test to decide if the veins are in fact bad in the leg, and that perhaps we can do something about it. That's the mild end. Vein disease can progress, and it progresses in a very small number of people, but it can progress to the point where the skin becomes damaged. So the skin becomes thickened, reddened, and then when you have those type of issues, sores or cuts on the skin sometimes don't heal, and that causes venous ulcers. And that's a much different thing than just a simple varicose vein. Venous ulcers require treatment, otherwise it can get worse and can cause significant problems. Okay.
So what are some of the symptoms or some of the symptoms of varicose veins? Do they hurt, painful, and do they happen most of the time? You hear about them mostly in the legs.
Right. That's the most common place. They can, in terms of causing symptoms, they can be achy. They can cause leg heaviness or leg tiredness. They can bleed. If they become large enough and they stretch out the skin enough, they can rupture and bleed. That's clearly an indication to do something about it, because that's troublesome for most people to have this varicose vein that bleeds. They can clot, and that does put people at slightly increased risk of deep clots.
Okay.
So clotting and the bleeding, that's clearly an indication to do something about it. But even if you have varicose veins and you have leg symptoms, so whether that's heaviness, fatigue, pain, there's 20 different words to describe it. It's always worth at least getting it checked out.
Okay.
They're often written off as, just muscle pain, or my knee hurts. But until you see somebody and allow them to evaluate you, we don't know.
Okay. Is it hereditary? Like if you look at your mom's legs, is there a chance that you're going to get it too?
It can be. It can be. The people are at, especially higher risk. Women is much more prevalent. We think the hormone changes during pregnancy have an effect on the veins and the vein health. People that stand a lot at work or sit a lot at work. Standing and sitting are the two worst things. Exercise is good.
Okay.
So the things that, the first line treatment that we offer everybody is exercise. Weight loss is very helpful. And then probably the third and probably most important is compression. So you've probably heard of compression stockings. They're not very popular. They can be hard to wear, but they're very effective if worn properly. And compression stockings, they're a medical grade sock that you wear on a daily basis, and it actually kind of squeezes the tissue and helps the legs pump that blood out.
Okay.
Because on the veins, the arteries have the heart. to pump the blood down to the tissues. The veins don't have a pump.
Okay.
So they rely on gravity and the muscles to push the blood back. And if you're standing and sitting a lot, then gravity is your worst enemy.
Okay, it's just sitting there.
Right. So these stockings help propel the blood back to where it needs to be.
Okay. So how does varicose vein surgery work? If that's the choice that someone needs to have, how does that actually work?
There's a few options.
Okay.
At Carl, we have a wonderful vein clinic, and you'll see specialists that do this every day. The traditional way was vein stripping, which involved making an incision on the leg and actually pulling the vein out of the body.
Okay.
It was effective, but it's associated with a bit more discomfort, as you can imagine, more bleeding, more bruising. So past 10, 15 years, we've come up with less invasive methods that involve catheters. So we will ultrasound the leg if we detect a problem with the vein and you have symptoms that correlate. Again, we try to get people on the non-operative side of things, get the compression stockings, the exercise, the weight loss. If that doesn't work, then the therapy that we do most of the time is a catheter-based, either a laser or some sort of heat applied to the vein that actually burns the vein and closes it down.
Okay, so you're keeping it in the body.
The vein stays in the body, but there's no blood flow through it.
Okay.
So in effect, it does the same as a vein stripping, except it's associated with much less pain, much less discomfort. People walk out of the office, they can go to lunch or dinner that day. There's really no downtime. So
Okay.
it's been a nice step forward in terms of vein treatment, and it's effective. It's almost as effective as vein stripping.
Okay. So in these last few minutes, what I've realized is that, healthy arteries and veins can prevent a lot of problems. So let's talk briefly as we close here. What are some things that we should be doing now to kind of keep our vascular system healthy?
So, if you're at risk, if you have the risk factors that we talked about, the smoking, the hypertension, the high blood pressure, the cholesterol, a family history, it's important that one, your doctor knows about that, and that they can order the appropriate testing. I mean, often when people come to see me, they've had a test. Oftentimes they don't know why they're there because they're not having symptoms. They may have a blockage in their neck artery that needs attention, or they have blockages in their leg arteries that need to be discussed. So, I always encourage people to just be engaged with their health care, ask questions, know why the doctor's sending you to a specialist. And I spend a lot of time just explaining, what we're looking at, what the tests mean. A lot of the people I see on a daily basis don't need a surgery, don't need a stent, but they need good follow-up. So we need to keep an eye on the blockages in their neck. We need to keep an eye on the blockages in the leg. If they have a small aneurysm, we need to watch that so it doesn't get bigger. And then, again, just promoting a healthy lifestyle. So smoking cessation, I know I said that probably 100 times, but it really is the biggest thing that we can do to help our vascular health. A good diet, exercise, walking 20 minutes a day, 4 times a week. And again, just staying engaged with your physician and asking good questions.
Well, and it sounds, those kind of lifestyle changes can certainly help with lots of other problems down the road. Well, Dr. Wheatley, thank you so much for coming on the show. It's great to have you here. We'd love to have you back again.
Anytime.
All right, thank you.
You're welcome.
Being Well is also available online at our YouTube channel, youtube.com/WEIUTV. Just look for the Being Well playlist. Here you can view current as well as past episodes.